Hello, I'm Dr. Roopa Mehta. I'm an endocrinologist and I work at the National Institute of Medical Sciences and Nutrition, Salvador Subirán, in Mexico City. And on behalf of my colleagues, Dr. Bakris, Dr. Rossing, and Dr. Sumithran, I would like to invite you to our upcoming webinar titled Diabetes Management in Chronic Kidney Disease, Mastering Complex Cases. So diabetes, a chronic metabolic condition, is increasing worldwide. And in fact, we're living with a global epidemic. One of the most devastating complications of diabetes is chronic kidney disease. And this results in significant morbidity and mortality among individuals with diabetes. For a clinician, we really do need to know how we can diagnose this early and also the best management options for our patients. In this webinar, we will discuss the 4 pillars of management, and we'll also go into detail regarding the newer medications that have had impact on the progression of chronic kidney disease. And with that, I'll hand you over to my colleague, Dr. George Bakris.
Hi, I'm Dr. George Bakris, Professor of Medicine and Director of the Comprehensive Hypertension Center in the Diabetes Unit at the University of Chicago Medicine. I'm excited to tell you about the section coming up on diabetes and chronic kidney disease management. It's important that you know that we now today have established 4 pillars of therapy to slow progression of diabetic kidney disease. Obviously, good glycemic control, obviously lipid control, but on top of that, we have maximally dosed ACEs and ARBs. On top of that, SGLT2s. On top of that, finerenone. These are data with agents coming from large outcome trials. And next year, we're going to have information on GLP-1 RAs from the FLOW trial, which was stopped early for overwhelming efficacy. So using, just like the heart failure cardiologists do, these 4 agents, you can maximally slow kidney disease from diabetes. Number 2, and very important, albuminuria has not been measured routinely. Albuminuria is the key link. It's the product of the kidney, and it's the key link that'll help guide you as to how the kidney is doing, independent of estimated GFR. And there are multiple papers that have come out within the last 5 years focused on this. So you need to measure spot albumin creatinine along with GFR if you really want to know what's going on with kidney function in patients. So this is stuff that is relatively new to you if you haven't been following the literature, but it's all going to be discussed and outlined for you at the meeting. We look forward to seeing you, and thank you very much for your time.
So we've seen that we need to have a comprehensive understanding of the factors that are crucial for healthcare professionals to manage chronic kidney disease. We need personalized treatment plans and interventions to prevent or even slow the progression of this complication. Combining glycemic control, blood pressure control, lipid control, and also introducing the latest medications together with lifestyle modifications, we can help mitigate the progression of this disease. So please join us in December for a case-based discussion to explore in more detail the intricacies of diabetes and chronic kidney disease and the strategies for effectively managing and mitigating their impact on individuals' lives. Thank you.